Sir, good morning.
Good morning, sir.
Good morning.
Good morning.
Sir, Dr. Peter Patel, sir, is there in the meeting. So,
सर्वजण आलेत?
हो sir.
Yes, sir. Yadam sahib, good morning.
Good morning. Good morning.
मॅडम कदम साहेबांची ओळख करून द्या पटेल सर.
Yes, sir. Yes, sir. Dr. Peter Patel, sir, we have our honorary secretary, Honorable Advocate Sandeep Kadam, sir, with us.
Good morning, Advocate sir.
Good morning, sir. Good morning. नमस्ते.
Namaste.
नमस्ते. नमस्ते. Good morning.
बाकी झाले ना झाले.
सर आवाज म्यूट आहे तुमचा.
सुरू करायचं मॅडम.
सर, सर सुरू करायचं का कदम सर? सरांना अनम्यूट करा.
हा, एकच मिनिट. त्यांना मेसेज पाठव. केलेलं ना? सरांना रिक्वेस्ट पाठवा ना अनम्यूटची.
व्हिडिओ त्यांचा ऑफ आहे सरांचा.
आवाज इकडे तो लॅपटॉपचा आवाज पूर्ण बंद करून टाका.
Sir, with your permission, can we start, sir?
Yes, sir.
Around 400 participants have already joined, sir.
Very good.
Yeah, so we'll start, sir.
Hello. Hello, everyone. Is I am visible and audible?
Yes, sir.
Yes. Okay, I'm going to start. Okay. So we have already 416 participants, attendees are there. So hello everyone and welcome to today's international webinar on a role of pharma profession in a disaster medicine by internationally recognized personality Dr. Peter Patel. I am Sagar Bhise, working as a lecturer in Seth Govinda Raghunath Sabde College of Pharmacy, Saswad. It's near Pune in Maharashtra state. On behalf of Pune District Education Association, I would like to welcome all office bearers of PDEA, all principals of various colleges, the other panelists, teachers, and last but not the least, all the students of different colleges. This international webinar is a part of various activities like a webinar series, Anant Vyakhyanmala, various types of competitions arranged by PDEA on the occasion of birthday of our beloved leader, Honorable Ajit Dada Pawar Saheb, a Deputy Chief Minister, Government of Maharashtra and President of PDEA Pune. These activities are being arranged to upgrade the quality of education and add in the knowledge of staff and students about various fields. We all respect and salute to the visionary leadership of our President, Honorable Shri Ajit Dada Pawar Saheb. We wish that everyone could have a political leader like you. Here wishing you a very happy birthday. Now I request Dr. Rajashri Chauhan Madam Principal, SGRS College of Pharmacy, Saswad, to preface our today's session.
Thank you. A very good morning to all. On respected office bearers of Pune District Education Association, Pune, Vice President Honorable Shri Rajendra Ghadge sir, Honorary Secretary Honorable Advocate Sandeep Kadam sir, Treasurer Honorable Advocate Mohan Rao Deshmukh sir, Deputy Secretary Honorable L.M. Pawar sir, Assistant Secretary Honorable A.M. Zadhav sir. Our today's speaker, a very eminent and versatile personality, Dr. Peter Patel, International Director, Faculty of Disaster Medicine, Birmingham, UK. All the dignitaries present in the panel, all the respected principals of various colleges of PDA and other colleges, all the staff and students of various colleges of PDA and pharmacy colleges. On behalf of Pune District Education Association and pharmacy colleges, I would like to extend a very warm welcome to you all for this international webinar on role of pharma profession in disaster medicine by Dr. Peter Patel. I would also like to welcome Honorable Dr. Rajendra Jagtap, President, Society of Emergency Medical Services, Maharashtra, and also Dr. Rajini Indulkar in this webinar. At the outset, I would like to take this opportunity to offer loads of wishes of good health and great success to our beloved leader, our inspiration, Honorable Shri Ajit Dada Pawar Sahib, Deputy Chief Minister, Government of Maharashtra and President of Pune District Education Association, Pune, for his birthday on 22nd July. As we all know that pharmacy profession is a very, very vital component of healthcare system. Pharmaceutical care, which is a need of an hour, essentially signifies the shift of pharmacy practice from being drug product oriented to patient oriented for improving patients' quality of life. In today's healthcare system, pharmacists do not play the traditional role of mere preparation, dispensing, and selling of medications. Rather, they are playing the multiple role of caregiver, a communicator, teacher, researcher, decision maker, leader, manager, and so on for individualized patient care. Moreover, pharma professionals can also play a crucial role in disaster medicine. Disaster medicine provides care to the victims of natural and man-made calamities with the specific consideration of timeliness and availability of the resources. As we all know, at present, the whole world is facing the deadliest disaster ever, known as or which is called as COVID-19 pandemic, which has already taken many lives in the world, and it is also taking toll on physical and mental well-being of the mankind. And this is the reason why we have chosen this topic for today's webinar. The main purpose of this international webinar is to sensitize and help pharmacists or pharma professionals realize their social and professional responsibilities towards community in such situation of crisis. Looking at the commendable work and valuable contribution in the field of disaster medicine for more than 3 decades, we just could not think of any other person than Dr. Peter Patel sir to be the resource person for this today's international webinar. Dr. Peter Patel sir would be guiding us on the concept of disaster medicine, and eventually the role that pharmacists would play in disaster medicine. I once again welcome and thank Dr. Peter Patel sir on behalf of Pune District Education Association for sparing his valuable time with us in spite of his busy schedule. I am sure that all the participants would get enriched with the knowledge in this particular field at the end of his session. Thank you very much.
Thank you, madam. Now I request Honorable Advocate Sandeep Kadam sir, Honorary Secretary, Pune District Education Association, to address the delegates.
Namaskar. Namaskar. Good morning to everybody. Today we are present here for the international webinar on the role of the pharma professions in the disaster medicines. The chief guest of this function and keynote speaker of this function, Dr. Peter Patel, International Director Disaster Medicines from UK, Advocate Mohanrao Deshmukh, L.M. Pawar, Sri Jadhav, who are present here, Dr. Rajeshri Chavan, Principal of the Saswat Pharmacy College. I wish to welcome all the office bearer of the staff of PDA, all the panelists, all the colleges of principals, colleges, colleagues, staff member, teaching, non-teaching staff, students, and ladies and gentlemen. I also welcome Dr. Rajendra Jagtap, who is the president of the Society of Emergency Medical Service, State of Maharashtra. I also welcome to Dr. Rajani Indulkar. The Pune District Education Association is pioneering organization contributing in the field of education in the Pune district, specifically in the rural area since 1941. PDA is a proud recipient to the Adarsh Shikshan Sanstha Awards by the government of Maharashtra. At present, the total 64 educational branches are working under the PDA, and the total 95,000 students are procuring the quality education, and near about the 4,000 teaching and non-teaching staff is working in the PDA. As part from the basic schooling education, PDA also keen to provide the quality professional education to the student in the various fields such as Ayurveda, pharmacy, engineering, architecture, management, and BVOC, Bachelor of the Vocational Courses, which is the most important at the present situation. Since last 7 years on the occasions of birthday of Honorable Ajit Dada, who is the Deputy Chief Minister of Maharashtra and the President of the Pune District Education Association, it means in Marathi, Pune Jilla Shikshan Mandal. On the occasion of the birthday of the Honorable Dada, on 22nd July in every year, the PDA has organized the National Cycle Rally. And it's include the various national and international players from the other state and performance his sportsmanship. The competition also aimed to spread to the social messages like a save girl child, green environment, health and the hygienic. But this year, the rally is cancelled due to the crisis of the COVID-19 pandemic. Hence, the PDA has organized a series of online webinar and the Anant Vyakyanmala for the student as well as staffs through the Zoom meeting. From 22nd July to 26th July, with the aims of the providing the platform of the quality upgradations and the showcasing hidden literacy talent. The activity includes the lectures by the eminent speakers in the field of health, pharmacy, psychology, economy, social science, law, sports, and career guidance for the teachers as well as the students and parents. The online, the essay competitions and the drawing competitions e-content competition, post presenting, tree plantations. Also arrange the PDA for the student. And the participants will be offered the certificate of the participation and the winners will be facilitated with prize. Today's international webinar is one among the series of the webinar arranged on the occasions of the pharma sectors hold a very strong positions in the healthcare system. In the light of the current disaster of the COVID-19, along with the other medicines care professionals, pharma professionals are required to render the certain healthcare services to the society. Hence, we have invited the Dr. Patel, International Director, Faculty of the Disaster Medicines from UK, to enlighten us on the current global scenario of the pandemic and the role of the pharmacist in these circumstances. I wish to express my heartful thankful to him for accepting our invitations. Disaster medicines is the area of the healthcare specialization service serving in the dual area of the providing the healthcare to the disaster survivor and the providing the medically related the disaster preparations, disaster planning, disaster response, and the disaster recovery leadership throughout the disaster life cycle. The strength that the pharmacists provide during the disaster in their positioning in the community, they are considered the community landmark or the communication hub for the patient and are the typical the first healthcare service to resume the operations after the disaster has occurred. Role undertaken by the pharmacists in the disasters are within their scope of practice and are the typically an extensions of their daily duties. I convey my best wishes for this webinar. On the occasions of the birthday of the Honorable Ajit Dada Pawar, on behalf of the PDA, I hereby giving the best wishes to him for his future's work. Thank you.
Thank you, sir. Thank you for your valuable guidance. Now I request Ashwini Shevade Madam, Principal, Institute of Pharmacy, Hadap sir, to introduce today's versatile and dynamic personality, Dr. Peter Patel sir, International Director, Disaster Medicine, Birmingham, UK.
Thank you, BC sir. It's give me immense pleasure to present the introduction of today's eminent speaker, Dr. Peter Patel sir. Sir is the founder and international director of the Faculty of Disaster Medicine in India and Nepal and has special interest in developing training in disaster medicine planning in epidemics and pandemics. Sir is visiting professor for disaster medicine at Srihar, Chennai and joint chair of the academic board for disaster medicine at Srihar as well as Amrita Institute, Kochi. Sir took lead in establishing the first joint agreement for developing disaster medicine training for pharma profession with SGRS College of Pharmacy, Saswat. Sir also established partnership with 2 major hospitals and universities and 12 major hospitals for implementing disaster medicine training in India. Sir is also Assistant Governor of Rotary International District 1060 and awarded Paul Harrison Fellowship in 1996 by Rotary Club for exceptional contribution for humanitarian work in disaster in India. He has received special recognition from Basic UK for exceptional work in development of pre-hospital emergency care, that is PHEC. Sir is working with the PHEC Faculty of Royal College of Surgeons, Edinburgh, to develop an international PHEC course for India. Sir moved to UK in 1970, where he pursued his post-graduation training in medicinal chemistry. He has spent 22 years in UK academia with research focus on infectious disease before moving to the work in NHS. Sir is specialist consultant for healthcare sector in UK and development director of SBS Dental Group with over 25 years of experience of NHS. Recently, Sir was a non-clinical partner of Grants Hill Surgery, the chair of South Birmingham Commissioner Local Network and former CEO of South Birmingham Independent Commissioner. Sir launched the Faculty of Disaster Medicine in 2015 from Pune. The program focused on training the trainers in disaster medicine, enabling the region to build core clinical capacity for regional disaster. With this brief introduction, I request all to look at the video which is provided by Dr. Peter Patel sir, and after that, sir will guide us for today's webinar. Thank you.
साऊंड नाहीये.
आहे सर, थोडासा कमी येतोय साऊंड, पण आहे, पुढे येईल सर.
नाही येत मॅडम, आवाज येत नाही.
हा, येईल सर. थोडासा त्यांच्या व्हिडिओमध्येच थोडासा कमी आहे साऊंड. थोडासा पोर्शन आहे ज्याच्यामध्ये साऊंड नाहीये.
नाही, टेक्निकल काहीतरी प्रॉब्लेम दिसतो. साऊंड अजिबात नाहीये.
हा सर, जस्ट एक फ्यू सेकंड झालं, संपलेलंच आहे व्हिडिओ.
आधी चेक केलं नव्हतं का?
नाही केलेलं सर, थोडासा येत होता आवाज. आता बहुतेक काहीतरी टेक्निकल. ठीक आहे. डॉक्टर पीटर पटेल सर का सुरू करत नाही.
Okay, I mean, is this, with the permission of the host, is this where I start?
Yes, sir. Yes, sir. You may please.
Okay, good
Yes, sir,
morning.
please. Yeah.
I'm sorry, I'm just waiting for indication at what point should I be starting. So it looks like it's my turn now to say good morning to all of you. And Advocate Sandeep, Dr. Rajashri Chavan, Dr. Rajan Jagtap, Dr. Rajni Dukar, and eminent panelists. It's a great pleasure and actually a privilege to actually address you, the panelists and the group over here, the visionary group who actually are taking forward the idea, the whole vision of disaster medicine, which is very, very important throughout the world, okay? And what I'm going to try and do is see if I can share my screen now with my presentation. I do apologize for the technical problem we had with the video, but this sometimes beyond our control, and hopefully we haven't lost much on that one, and we'll pick it up during the presentation. I have been also been requested that some of the viewers may prefer to simplify it and have a bit of Hindi. So I will try and do a little my Mumbai Hindi. I can understand a bit of Marathi, but Hindi, जो Mumbai Hindi है ना, वो चल जाएंगी आज तो rather complex scientific या medical terminology को उसको हम कम करेंगे आज. So इसके लिए कि जितने भी 400-500 participant है, जो कोई नॉन मेडिकल होंगे, नॉन फार्मा होंगे, तो वो भी ये बात को समझ सके कि भाई डिजास्टर मेडिसिन और फार्मा प्रोफेशन और हम सब कैसे काम साथ में काम कर सकते हैं. So let's see if I can get this share screen going.
Yeah, go ahead, sir. You already provided.
Going back to technical. Okay. Nope, not seeing the screen. Let me see. Start again, stop share.
Minimize, sir. Minimize your window. This Zoom window, minimize, then start the video.
They're not done. Okay, so I'm going on a share screen now.
Yes, yes.
Okay. And then I need to go to desktop. So
Desktop. Yes, yes, yes.
Yes, sir.
okay,
Minimize this.
Minimize this.
Minimize this.
minimize this.
Yeah.
Yeah.
Now.
Minimize.
If you minimize this, yeah, please
Yeah.
minimize this.
Yeah, yeah. Now it is visible, sir.
Yeah, now,
Start your presentation, sir, now.
Okay,
yes.
right. Let's see if this works. Okay, can everybody see this
Yes,
screen?
sir.
Yeah, yeah.
Yes, sir.
Okay.
Very clear.
So there we are. So for those of you who know me, my real name is Pankaj. Okay, not Peter. And I'm actually one of you guys. I was born in Pune.
Very good.
Not far from St. Vincent's College, a school around between Cantonment and City. And I have got many, many years of experience, but living there, the pleasure of living and actually the fun of Pune. And I keep on coming back to Pune practically 2 to 3 times a year just for some of the work and catch up with some of the colleagues. And Pune is our headquarters. Literally this is where it started with Ruby Hall Clinic and Sancheti Institute and various other places. So it's a great pleasure to actually catch up with and be part of the Pune team over here. Okay, so today's topic, which is role of pharma profession, disaster medicine. The disaster medicine has already been defined by both of our eminent panelists. So I'm not going to go into more details, but I'm going to actually do it in 3 separate stages of this presentation. In the first bit, a bit of background of the work we have done in India. It's not all, but just some samples. In the second one, the main area, which is to discuss what is the current, consensus on the role of pharma profession in disaster medicine. And then if the time does permit, then we will go ahead and have a look at some of the disaster medicine areas, some of the disasters, such as anatomy, physiology, if that time permits, and then we'll go on to the question and answer sessions. Okay, so of course, again, it's a great honor and privilege to greet Honorable Ajit Dada Pawar on his birthday, which was yesterday, the President of Pune District Association, and to have the privilege of actually presenting this webinar to the people of Pune and around. Okay, so what is disaster medicine? Before I begin to explain what is disaster medicine, just a quick background to our work. Okay, now, so I started working in disaster medicine, as many of you know from the introduction. I'm a microbiologist by training, and my special interests have been infectious diseases. But for some reason, as a Rotarian of Birmingham Club, I got introduced to international humanitarian work, and that's how I started. So since 1993 to now, this is the kind of area, all those arrows you'll see, either we work directly in a disaster there, or we have actually visited this and advised people on disaster or made assessments. So that's quite a long time of actually work. And I don't know whether you'll recognize this. This is where I started, 1993, Latur Kilhari earthquake, and that's Kilhari, completely flattened. And I was asked by my Rotarian colleagues over here that there is the earthquake in India, in Latur, you come from that region, what are you going to do about it? And like typical young man, I sort of said, nothing. It's a waste of time. We raise money over here. We send it across to various people out there, various fundraisers, but we never know what happens to that money. There's no accountability, so we are wasting our time. And I got a reply, "Hey, तुम academics है ये सब, ये इतने negative views क्यों है?" So we started thinking that कुछ positive करना चाहिए ना कुछ constructive. तो हमने थोड़ा research किया, और research के अंदर ये था कि आप ये भी अभी भी ये this is true, कि disaster होने के बाद जो government है और जो NGOs है, वो 3 महीने तक काम करते हैं, और 3 महीने के बाद जो displaced people है, जो affected people है, they're not being looked after at all. They have more challenges. Many of them actually live in shanty conditions for up to 2 to 3 years. Their healthcare is actually lacking. So we started by saying, okay, let's actually do rehabilitation. And that's how we came into the healthcare area. So here is the first one, which is what we did. We actually identified, I've actually visited Latur and Kilhari in the region and identified where the needs were. And Javalgaon Poma Devi, a village not far from Latur. This is where we started our first healthcare center. And then
problem to संपली क्या capacity? Capacity संपली है क्या?
हो घोरपडे सर बोलू नका.
Okay. So this is where we started our work. And then we looked at Latur itself, and the Rotary Club Latur actually said that there is no trauma center over there. They don't have proper equipment. The schools have problems, and the school equipment in various kitchens and those. So we started some there and we built our first primary healthcare center there. And here it is. This particular healthcare center is still there, is still working. It was handed over. And now very quickly to go through the other projects we had. And then after the success of this first project, the request came from many other places like Gujarat cyclone, Orissa cyclone, Bangladesh floods, Gujarat earthquake. And this is sort of, not a comprehensive list of our work, but here is sort of in Gujarat cyclone, rebuilding schools and providing them with a community health center. Here it is our Lord Mayor of Birmingham coming with me to Jamnagar over there, handing over the community health center, and we are making sure that it actually does work and people, the community which requires the services are getting the kind of services we're talking about post-disaster. The point I'm trying to make here is that we are not kind of, the philanthropists, those kind who will write a check, fix a check, and go ahead and do what we want to do. So what we're trying to do over here is actually go to the site, meet the affected people, meet the communities, have proper consultations, and then provide them the essential healthcare and education-related facilities fit for purpose, and not just walk away from it saying apna kaam ho gaya, inko paise de diye aur laga diya record pe kya. So this is how we actually work. And came the Gujarat earthquake 2000, another example, and this was our single largest project ever. Instead of actually building healthcare centers, now the challenge we got was adopt a village. And I sat here one evening and all the Indian community in Britain, they came to say, Peter, go over to Gujarat, adopt a village, and we're going to rebuild it. Or kitne paise diye? 10,000 pounds only. Well, 10,000 pounds mein kaise village banega? Well, you don't worry about it. You actually just go ahead and do it. So we went ahead, went to Rotary Club of Jamnagar, and then they actually introduced us to Rotary Club of Baroda 6th group. And we managed to adopt first village, which was Nani Matli. And this is what we did. And then later on, we adopted another village, Sutarpur village. And our investment there was about 700,000 pounds. And our input there was also to make sure that the whole village was fit for purpose, proper sanitation, proper healthcare center, proper education facilities, and all that was actually done there. And let's see if we can make this move forward. Okay, so this is actually the visit to the earthquake zone in Bhuj. And these are my own personal pictures, and to show, whoops, what's happened there. I think we lost the screen here. Technically, how do we go back?
Sir, could you kindly check if it has got minimized? If not, you'll have to minimize this Zoom window and again restart with the presentation which is seen on the desktop.
Okay, can't see here where this launch
PPT is not coming.
Your final pharma professionals PPT.
Okay.
Yeah.
I'm going to start again.
Not
Yes.
visible.
Okay, we are back on track.
Now,
Yes, sir.
yes,
Okay.
yes, sir.
So this is the visit to Gujarat region, and okay, so while we actually adopted the village, here is actually a photograph where in the middle of August heat, I have got 3 young lads, they're about 17-year-olds from Birmingham School, and who actually raised enough money to build one house. One of them is my son, who is right in the middle over there, and his friends. And they volunteered to come and work in the disaster zone. And they actually broke all the rules. People said, oh, no, we don't work with the laborers over here. It's not allowed. And they ignored all that. And we managed to see if we can get this thing to move forward. Okay, so this is a completed New Martley village, and just an example of the kind of work we do. And coming to now, not going through all the different things, our challenges are slightly more, because when you do go into disaster region, we ourselves, so when I say people who work in disaster medicine or disaster, they themselves are at risk. So we had infections, severe diarrhea, we had respiratory infections. One of my visits was into the Tamil Tiger region of Sri Lanka, and nearly actually ended up being locked up by the Sri Lankan army. Then we had poor intelligence of what was happening there when walking around when in the areas of unexploded mines. So by the time I found out, I had to pull the team out of the risk. So the photograph at the bottom left, you'll see, is a mine clearing operation. But for 3 days, we were out in the region, just looking at how to help people, putting ourselves at risk. So there are other risks like high risk structures, being run off the road by trucks. And the one on the top left is Palestine, Gaza, and how to provide essential medical services in area of conflict, because the disasters over here even get more and more complex. So if I now move on to the next slide. Okay. As a part of our work, we actually do a review कि जो investment करते हैं, तो उसके बाद benefits क्या है और challenges क्या है. तो 2001 में गुजरात earthquake के बाद दो analysis की, तो पहले तो ये दिखाई दिया कि there is an absence of concept disaster management in medicine. 2001 में और 2000 में India में there was no NDMA, there was no sort of disaster planning or anything. Paramedics, ambulance services, they were absent. जो अपने ambulance से वो सब only they were ferrying people up and down, and sometimes they were only ferrying dead bodies. Absence of emergency medicine था, trauma team building का भी नहीं अपना था. वो अपने तुम जहाँ जाएंगे तो accident emergency नहीं तो casualty बोलते हैं. तो casualty में trauma team building तो थी नहीं, absent ही तो totally थी. और पीछे management and control of epidemics and pandemics, वो भी बहुत limited था. और जो हम बोलते कि disaster risk reduction या mitigation बोलते, तो उसके बाद discussion किया तो बोले कि ये क्या है, ये कैसे करते हैं. So these are some of the things we identified as being a problem. And then after doing that analysis, we actually started our first paramedic training course, which I'm going to show you here at Ruby Hall Clinic. So if you look at the Ruby Hall, they do a paramedic training course that was started by us in partnership with West Middle Ambulance Services as part of the Start of Disaster Medicine program. उसके बाद in 2013, 2015, 14 हमने वापस analysis की. तो once again जो pre-hospital care बोलते हैं, तो उसका provision was highly variable. Accident emergency, it was emerging. उसमें India में now there are only 25 major centers with qualified people in emergency medicine. And then trauma management team, it's still limited and variable. अच्छा, तो दूसरा immediate medical care concept, that is still sort of emerging now. And then we have statutory disaster management plans, so hey, मगर उसके अंदर जो effective disaster medicine planning और preparedness है ना, वो उसमें भी gap है अभी भी. तो अभी देखें तो even now, if we do a review, तो जो concept of disaster medicine है, वो अभी भी absent है. Clinical capacity for disaster medicine, वो भी एकदम बहुत कमी है, is poor. और जो working approach है, वो एकदम अपने silo type का approach है. जो resources है healthcare के disasters के लिए, मगर overall India का spending only 1.3% है GDP का है. It is one of the lowest in the world. और अगर training देखेंगे, तो dedicated training for healthcare professionals for disasters and disaster medicine is very limited. अगर इसमें आप देखेंगे तो अभी जो COVID-19 का situation है, and उसके healthcare preparedness आप देखेंगे, hospital preparedness देखेंगे, ambulance service का preparedness देखेंगे, तो वो सब में बड़े बड़े challenges है. So we have some major challenges to look at, and we still continue to do that. Now I'm coming to one example of if we're going to get involved in disaster medicine, then you can't do it from sitting in an office and in a desk. You really have to go into some of the areas and understand it. So in 2017 and 19, I took a team and we actually set through Puri Rath Yatra. This is one of the mass gatherings of several mass gatherings which are at risk of potential disasters. And we had to study this in detail to see the challenges such kind of gathering have, where the resources are, where the teams are, what the training is, and how do you, if there is a disaster, what will be our risk reduction, mitigation, and then actually our preparedness to actually action and manage these disasters. So this is the District General Hospital in Puri. And here you will see on the bottom left-hand corner, this is the police control center, which actually sees overall crowd movement. That's the pharmacy in the hospital on the top left. And this is where the drugs are prepared 2 days before and left at the high temperature of 40, 41 degrees. So many of these drugs will actually have challenges. The doctors have just been given the same instructions, but no training. And here on the bottom right, you see this person, he's actually cutting up the cloth gauge for wound management on the floor, which will be then put in a stainless tray and then will be used for any sort of injuries out there. So here are some of the things which you have to look at, and then how do we actually change the system, how do we improve it? So if we look at now the Indian subcontinent, 85% of India is vulnerable to one or multiple hazard. And then we have earthquake prone areas. So I'm not going to go into that, but 18% severe, 25% damageable, 12 to 18%. So we have many, many areas in India which are actually going to be earthquake prone. Then we have landslides, cyclones. So we have the whole of the East Coast, which is actually prone to cyclones. Then landslides. Landslides occur up in the Himalayas in North India and Nilgiris, but then parts of Maharashtra also have seen mudslides. So these are some of our challenges. And then many people in India still die of cold and related diseases every year, mostly from poor urban areas in northern parts of the country. And now, not to forget, infectious diseases outbreaks. Epidemics are common: dengue, cholera, some outbreaks of Nipah, Zika. So these are all, which present some major challenges to us. And India is also at risk of what we call CBNR, chemical, biological, nuclear, radiological accidents and disasters. And I'm not too sure how each state is prepared for it. How we have how these challenges are reduced. We know that there is a group in NDMA who actually specialize in it, but there is a huge gap in something. When the chemical disasters happen, by the time we get a response, it's a reactive response. And obviously, India, like majority of the world's nation, is not prepared for global health security. Why do I say that? COVID-19. COVID-19 has actually shown us that while something like over 200 countries were surveyed on their preparation for global health security, and some of the countries like US, Britain, Western countries, they were all shown as being prepared for such pandemics, but we have now found out that not a single country in the world actually was properly prepared for global health security. In fact, they were so badly prepared that we have a major disaster on our hands now. So India, I'm repeating the same thing, like developing countries, we have a reactive healthcare system and we have a reactive preparedness for disasters. We have absence of disaster medicine in both national and state disaster management plans. But when we talk to people out there in the Indian administration, they do say, oh no, we are okay. We have done it all, here it is. But when you really see post-disaster and how to actually implement the plan, then you know there are huge gaps in it. And right now you see public-private partnership in COVID-19. The government is asking now support from the private providers, and which is, of course, has to, because that is why it's a disaster, because it's beyond the ability of the local and national government to deal with such a situation. So disaster medicine, we're not going to go into it, but if you start looking at anything, first 4 questions you ask is, what is it? Who are the stakeholders? Who should be involved? How should it work? And why is it important to us? So disaster medicine is part of disaster management. It's not something separate. Disaster medicine is not emergency medicine. It's even bigger than emergency medicine. It's not like trauma orthopedics. It crosses the whole spectrum of medical, surgical, and healthcare system. So disaster medicine, who should be involved? Okay, and usually I get a limited number of answers of our paramedics or ambulance service people, or they'll say emergency medicine doctors, orthopods and all that. But if you really look at the whole range of people who should be involved, okay, this is not a comprehensive list. Okay, we have pre-hospital emergency care people, emergency medicine, trauma orthopedics, public health, infectious diseases, pediatric emergencies. So if you really look at people who are displaced out there in refugee camps, in displaced camps, there'll be infectious diseases, there'll be pediatric emergencies. If you really look at Rohingya refugees, some over 40,000 babies were born in those refugee camps, obstetrics and gynecological problems. Laboratory medicine is very, very important, because when you have a large number of people coming into your hospital injured in different ways, then what are you going to do? You require imaging people, you require people in pathology or blood transfusion, amount of blood, platelets. Right now, it's with COVID-19 plasma. So laboratory medicine is also important. Mostly ignored is primary care. General medicine, pain management, rehabilitation. And of course, if you look at every possible documentation, who is forgotten? Pharma profession. And they are usually forgotten by most planners around the world. Role of pharma profession, disaster medicine, as I said, is very important. Mostly ignored, under-recognized, and underused. So we need to actually change this and see what we can do. What's the most widely accepted role of the pharma profession? Is logistics, supply chain management. Okay, practically every disaster, people will actually do this logistics, supply chain management. However, if you see more recently now, new drugs, we require new drugs for things like COVID-19, HIV, and many of the drugs, like dengue, and vaccine development. So pharma profession have a role continuously throughout. You don't have to wait for disaster if you're going to look at new drug development, vaccine development. Okay, some of the roles of pharma profession, some of them are formal, but most of them are in the government agencies, and some informal. And currently, the pharma roles are underdefined, underused, poorly developed, and grossly undervalued resource. This is one resource which really needs to be looked at as a future part of disaster medicine. Okay, pharmacists have special strengths. I don't know, but most of the people think of pharmacists as the retail pharmacist, community pharmacist, who dispense. But as the principal madam said, the pharma profession is much bigger, much wider than that, but they have a very special position in the community. And in many countries, after disaster, pharmacists are the first community health services to start working. And that is quite, evidence-based around the world. So when did pharma profession's role really become important? More recently, it was after September 11, 2001 in the United States. That's when they started looking at pharmacists' role, and then Hurricane Katrina in 2005. The roles over there in US, they established that the pharmacists can handle the response and recovery of community post-disaster. And there are quite a few publications on that one. And I'm just going to go through some of this areas where we'll look at the pharma role. In most disasters, there is a collapse of community health service, and the affected communities become cut off from outside assistance. In US, there was a new regulation came in that pharmacists could prescribe emergency supplies up to 90 days. Previously they could only actually, dispense and give medication up to 3 days for emergency. But then under the new regulations, which came after Katrina, they could actually prescribe medication. So here is a role where supports affected people, where the rest of the health service is actually inactive or incapacitated. Now, so an analysis of the pharmacist's role, which followed Hurricane Katrina, it included triaging services within the evacuation centers, taking medication histories, providing vaccinations, performing basic medical checks, mixing intravenous medications, providing consultation for minor injuries, wound, assisting with major traumas, assessing the contamination of medications brought in, and of course, spill identification. Because I don't know whether you're post-disaster, if you're going to a refugee camp, displaced people, and people will have a lot of medications with them, and they haven't got a clue what I'm going to do with this medication. Because the labels have come off, they're not properly labeled. So pill identification and being able to do. So this is some of the things which they did. Okay. And we had the biggest study, and there are something like 250 major publications on the role of pharmacists in disasters, but I've only taken one which is quite comprehensive. 15 experts के panelists a Delphi study करके है. They've identified 46 roles were identified for pharma professionals, 46 roles, okay? And out of this, the expert group actually said 43 roles have been accepted as appropriate for pharmacists to undertake in a disaster. And I'm going to go through a summary of this one. I'm not going to go into the detail of this, okay? Again, let me just go on because this is just more area of the Delphi study. And okay, so here is one which is the final consensus, 9 roles pharmacists are capable of undertaking in disasters. Okay, besides being part of preparedness. Now, pharma professional can make sure the whole medical chain supply is available or where to resource them in a disaster and response level, at the response level. So uninterrupted supply of medications in disaster. Of course, can advise the government on how to stockpile certain pharmaceuticals, certain drugs for the disaster. There's also treatments and drugs when you have bioterrorism or infections, anthrax, plague, tularemia, where you require antibiotics. So pharma profession have a major role to play in that one. Enabling the community to understand and manage their own medical challenges, and having a system in place for secure cold chain lines, where the pharma profession comes in. And I'm going to go on to the next one, okay? The 5 major roles which the Delphi study actually identified is administration of vaccination, educating the public on reduction and spread of communicable diseases, point of care message, okay, and increased awareness of the risk if you're living in a disaster region and post-disaster system. And the final consensus was of the 21 roles that pharmacists can play, and out of which, once again, I've only highlighted few of them. Triage of low acuity patients, so is one. Undertaking CPR, okay? So we can train the pharma professions in pre-hospital emergency care. It's not actually rocket science, and many of the pharma profession over here have been trained. And if you look at many of the NGOs, their pharmacists also been trained when they actually go into these regions. Making therapeutic substitutions for drugs available, which actually become, you know, when the main drug disappears from the marketplace, what's the alternative? Monitoring the chronic disease of at-risk population. So chronic disease monitoring, long-term condition, and all these roles are available for the various people. These slides will be available, they're being recorded. So the pharma leads can actually have a look at these roles and actually understand what the challenges they will be. And this final slide on the pharma profession. So we have 5 priorities, 1, 2, 3, 4 on the left, but then we have a role in prevention. We have a role in preparedness. We have a role in response, and we have a role for them in recovery. And if they understand this and actually put them into training of pharma profession, then they will be able to be part of the disaster medicine team, okay? And this is where we finished the pharma role. Some of the major other roles is global health security. Global health security, preventing, risk reduction, resilience and building. And this is not only about international global health security, but national capacity to prevent, detect and respond to infectious diseases threat. And again, I repeat, what do we have? COVID-19. And like most of the countries in the world, we were poorly prepared for it. Our preparation response was too slow. So here, pharma community has a role to play. In future, the next predicted major disaster, which is likely to be, coming in future, is going to be superbug. Antimicrobial resistance is actually spreading worldwide. And sooner or later, we are going to have superbug or superbugs, which will not be able to treat, and that's going to be next major global disaster. Pharma community can also be involved in epidemic intelligence services, because communities most of the time either see a primary care doctor or the local pharmacist. And if they come for same problems and complaints again, then you can see that there might be a emergence of an epidemic. Pharma professionals are also very, very important in new mutants of virus and bacteria, new mutants or viruses and bacteria, how to actually produce drugs for them, new either vaccination drugs. And of course, in more detail, I'm not going to go into more detail, but nuclear and chemical threats and accidents. And there's a role for pharma profession there as well. Okay. So at national level, improving national health security. There's also a major role in actually helping to manage non-communicable diseases, NCDs, such as hypertension, cardiovascular disease, chronic lung diseases. Many of these can be managed and supported by pharma profession post-disasters in refugee camps. But if you really look in the modern sort of services now, a lot of this work is done by clinical pharmacists in routine work over here. Again, safe medicines and biopharmaceuticals, there's a role there for pharma profession. Okay, so where do you start for pharma professionals? Well, SGRC College of Pharmacy, Saswad, is a pioneering partnership with the faculty, and we are working with them to actually develop this particular disaster medicine training center. And the person really started this ball rolling is the former principal, Dr. R.Y. Patil. And then we have the new principal, Dr. Rajashri Chavan, Sagar Vijay, and the team who's over here, who are actually going to follow in, we're going to take over this program to see how we can involve pharma professions. So where do you start? Definitions, anatomy, physiology, and this is not the place and time for us to start teaching people about all these things. So I'm going to start now coming to an end of this presentation so we can have more question answers which are relevant to you and which we can actually discuss. So very briefly, disaster medicine, what does it do? It seeks to prepare for, manage, and reduce the adverse impact of human health. When events which are disasters, earthquakes, floods, cyclones, man-made, adversely and seriously affect the life and livelihoods. That's our definition of disaster medicine. And we'll go quickly through. So what do? We really look at all the different disasters. These are natural, and I'm going to say rapid onset, nuclear disasters, man-made disasters, chemical disasters over here, Bhopal disaster over here. And people always forget the slow chronic onset, the drought and famine, and these also are man-made, can be, and so there are actually healthcare implications over here. Mostly healthcare implications are deaths, morbidities, poverty, loss of livelihoods, number of people affected. And then a health implication could be intermediate, short-term, or long-term. Disasters don't have to be simple, just it's not an earthquake, only a flood. There can be complex disasters, and the healthcare needs will also be more and more complex. So the impact, the disasters don't differentiate between rich and poor, or big or small. Deaths, serious injuries, minor injuries, infectious diseases, long-term poor health rehabilitation. Mental health is often forgotten. The vulnerable women and children and the exploitation. Then we have indirect impact on health through loss of homes, businesses, loss of jobs, and it increases the burden on the healthcare system. It increases poverty and it delays economic recovery. So disaster medicine cannot work in isolation. It has to work along with fire emergency services, police, healthcare planners, civil engineers, safeguarding people, epidemiologists, healthcare informatics, communication experts, transport and logistics. So it's not a simple thing where we actually say, oh, yeah, disaster medicine will work on our own. We have to work with a wider group of people. And with that, I actually end my presentation. Gratefully acknowledge the exceptional vision of the Pharmacy College, Pune District Association for inviting me to make this presentation. And thanks to Dr. Rajan Jagtap, our regional faculty lead, for coordinating this initiative. So, in summary, it's a partnership approach. It involves countries, many institutions. It's a people-centered approach. It's a proactive project. It's a project with solutions, and it's a vision for future. But most importantly, together we can make a difference. Thank you very much.
Hello. May I ask question?
Hello.
Hello.
It's over to you.
May I ask question?
Yes, yeah, it's over to you.
Yes, yes. Just a minute, sir. Just a minute, sir. Oh, Kali sir, mute kara.
Dr. Patel, it was very informative and elaborative session. Can you hear me, Dr. Patel, sir?
I can hear you.
Yeah, Dr. Patel, sir, I got two questions. Especially these questions are about Corona crisis. How do you see impact of Corona in India versus impact of Corona in those developed countries like Europe and America? And number two, sorry, sir, I'm asking two questions in one question. And second question is, what are the important medicine that you find which ought to be there in India, but are not there in India? Thank you, sir.
Okay. Okay. To answer your first question, okay. The thing is, Corona, COVID-19, it actually took everybody off the guard, you know, including WHO got it wrong. Okay. I came there at the end of January and February, and we were actually following, you know, at that time it was called novel coronavirus, the China, or as Trump says, the Chinese coronavirus, which many people don't like. And Europe thought it will not actually affect them. US thought we are too far, nothing's going to happen to us. But they were all proven wrong. Europe was the first one, which became the epicenter, followed by US, and now we have India and Latin America and Africa. They're becoming big epicenters. When I presented the training, I will tell you, there are four. I offered it to Goa, Mumbai, Delhi, Pune, and Chennai. And you know, Delhi guys sort of said, you're coming here on a Friday afternoon, and I'm sorry, we actually leave the hospital and go home by 4 o'clock, and we don't work at weekends. So we don't think we want to know anything about COVID-19. And the day I was arriving in Mumbai was Saturday evening, so Sunday was available. And this was a disaster management training of the city. And they had said, yeah, we're interested. And said, no, we don't work on a Sunday. Disasters don't wait. It's not on a Sunday, a weekend, or a Diwali. Disasters happen anytime. Okay? Only two groups, Pune and you know, Sri Ramachandra, they took the initiative, and we all did half a day training. So none of the countries, including the top countries in global health security, on a piece of paper they were prepared, but every one of them has been shown to be not prepared. Now in India, we have a challenge. The problem with India, or the challenge of India, are that we have something like 27, 28 states and union territories. And each one has a different way of working, different regulations. Then we have a challenge of non-compliance. You know, the public are not actually complying to lockdowns. They're breaking every possible rules.
Yes, unfortunately.
Okay? In terms of drugs, unfortunately, the limited drugs we have, the remdesivir, hydroxychloroquine, all those, they are limited in the supply, the remdesivir and the new ones coming in. And they also are useful to limited number of people who are into moderate to severe, to reduce the symptoms from, say, 7 to 5 days to 3 days. But people with comorbidities and others, we are going to see a huge number of deaths. And I've got a slide on the one which I'll share with you later. We are number 3 in the world. From 2,000 a day 4 weeks ago, we are now actually being 35, and yesterday was 40,106 number of new cases. And Pune has overtaken Mumbai in numbers of new cases, but also what we call active cases in Pune are bigger than Mumbai and you know, around here. So we have a problem. How do we solve this problem? Is actually understanding the population demographics, understanding the clusters, and closing that virus down in those clusters, supporting the people who have mild symptoms and asymptomatic, and not actually, you know, getting them into hospital, but also understanding that large number of a population they don't live in comfortable flats. They live in very crowded, they may have only 1 or 1.5 room with 4 or 5 people. So we need to actually make sure that these people are actually, the COVID positive patients are taken to a center which is safe, where they're unable to transmit the disease. You can't, like the Mumbai hospital, have a COVID ward and put extra beds in without any distancing and say, they all got COVID anyway, so it doesn't matter. All we are doing is increasing the viral load, so the person who's got mild symptoms keeps on getting extra doses of the virus. So understanding infection control is more important. And there are solutions to it. We are not going to decrease the number of infections we have. We just got to write it out, flatten the curve. So we got to actually flatten the curve means, instead of having huge spikes suddenly, if we actually make it over a longer period, the healthcare system will be able to cope with the demand from COVID-19. Okay, so it's a major challenge, and we are most likely to peak, I think, maybe September. Okay, before we start seeing any real changes. But then if wave 2 comes in and the winter pressures come in, we may have even a bigger challenge. And if a mutant comes in, it's not only we, the rest of the world is the same. We are seeing resurgence in Spain. We are seeing resurgence in many places in China, including Beijing, in Hong Kong. But then if you're able to identify them much earlier, we'll be able to isolate these people much earlier. Okay, so that's where the COVID actually stands. Sorry, what was your second question, sir?
Sir, how do you find kind of impact that has been there in UK, US, kind of medicine that doctor has been using to treat patient? What is the significant difference you see in Indian policy versus Western policy?
Well, there's no difference. What we have is universal health coverage over here. Okay, so the government has the stocks and it distributes it. There's no private medication or private supply, separate supply for, and the same drugs which are available. And most of the treatment is not medication drugs. Most of the treatment is supported treatment. US and Brazil right now are leading in the number of, having all the resources, highest number of deaths. And highest number, I think, if look at the US, the new cases were around 70,000 per day. Brazil, about the same, between 50 and 70, around those areas. And then India is leading just down there. So yes, there are drugs, but they were not, the drugs itself are not the solution. Containing the virus is a solution. And we have the question is herd immunity. And a lot of people think that herd immunity means let the virus go up and then the herd immunity will kick in. Unfortunately, on this particular virus, to get herd immunity, you will require 70% of our population to be infected. But when you look at the numbers game, of course, majority will recover. Okay, so recovery rate predicted is between 90 to 95%, in some cases 99%. Then you look at between 5 to 1% are affected. And not only the percentages, you actually calculate the numbers. And it is not, it's illogical to have those numbers not only infected, but some will die. But also, if you really look at the people who have recovered from the severe COVID, they will have long-term conditions on their lungs, on their hearts, on their kidneys. They'll all be damaged. Okay, and they will be significant. The evidence, the clinical evidence is there. The damage is done. So for the rest of their lives, they will need more health care, and that cost is going to go up and up and up. So there's no difference between what US is doing and Brazil is doing. If they have all the system, India is trying its best, but then India does not have universal health coverage as yet. Modi is trying to bring in universal health coverage, but then we have public-private majority of our services in urban are being provided by private providers. But the private providers are willing to actually provide the services at reduced cost of free of charge because they have to actually pay the bills. So I wish I could find you an easier solution, but there's not much of difference there.
Sir, I am having one question.
Yeah.
Dr. Patel, sir.
Yes.
Good morning. Sir, this session is very informative, especially you explained very briefly on this role of disaster, especially in the pharma system, because, you know, it is a very untouched issues, and you have explained, and it's a very eye-opening session. So thank you for that. But I have one question, sir. As you know, in this pandemic situation or in any kind of epidemic situation, if there is no specific drug is available, especially you have seen that in COVID-19, there is no specific drug, identification of drugs. So the whole country is searching or discovering a new drug for that. And ICMR guidelines is, as you know, that they are changing, especially in favipiravir, then remdesivir and all that. So in these cases or in this kind of epidemics or pandemic, what is the role of pharma industry in this disaster management? Because, you know, if there is any kind of drug and the clinical trials are going on, and this kind of situation, how this pharma industry can handle?
The pharma industry, first of all, if the drugs are available, India has got a good pharma industry which can produce drugs cheaply and quickly. Okay, and it's not about the industry; it's about the pharma professionals. If you really look at many of the drugs, including remdesivir and others, it's just not take the drug; they also have side effects and adverse effects. Okay, so you have to actually monitor a lot more of the health parameters when we're using these drugs. So I actually saw a post from a group of doctors who actually changed the ruling to say, oh no, we won't give the drug for 5 days, we should give it for 10 days, 14 days.
Yeah.
Now this is where we require pharma professionals to tell them it's inappropriate to actually just, so these doctors, oh no, if you give it to them much longer, it's much better.
Okay.
The damage to the patient will be worse, and it's not going to actually improve anything. So pharma, and in the research side, toxicity side, understanding the clinical outcomes, also bioavailability. It's great to get the drug, but will it be, when they take it through mouth, will it be absorbed properly? What's the formulation? This is where pharma professionals got a very important role to play. Do we need to give it intravenously? And then biopharmaceuticals. Pharma professionals got a huge role to play in developing new biopharmaceuticals. Does it answer your question?
Yes, sir. Thank you very much.
Sir, one more question is
Sir, I have one question, sir. Yeah, I would like to ask you one more question. Looking at this pandemic situation, we understood that our role being a pharmacist, it's our great responsibility towards the society. But I would like to know, rather we would like to know, because many students have joined these sessions, we would like to know that how many centers are available, training centers are available with related to the disaster medicines in India, and where they are located. How we can how students can reach out to that centers. Can you please guide us?
Okay, right now we have 2 centers. Means they're not fully operational, they are development centers. One is Sri Ramachandra University at Chennai and Amrita at Kochi, and then same Amrita in Delhi for North India will be there. We are looking for appropriate partners in Pune, Mumbai region, but so far we haven't found a partner who has the vision, innovative, and ability to do that. Okay. Now, in terms of the students who want to actually do this, we are just in the process with discussing with the principal Rajashri Chavan. How do we bring appropriate training for pharma students and pharma professionals via their college, training the trainers? See? And the other thing what COVID-19 has done is we are now changing the way of actually instead of doing face-to-face training, online training. Because for next 12 to 18 months, it's going to be extremely difficult to teach students in classrooms, both in US, UK, Europe, we're all changing that. And we have now evidence that a lot of knowledge can be imparted by online training. And it's only a small percentage of skills we then require to do hands-on. So your students will be able to actually get this training online from any one of these providers, including your college over there. When it comes to actually assessment examination, currently it will be either Amrita or Sri Ramachandra. It could be, and of course, not to forget, I didn't mention, we are also working with the Royal College of Surgeons, the FEC, the Pre-Hospital Emergency Care faculty. They are actually producing a new international course appropriate at level 1 for pharma professions. And they will be also conducting examination and giving an international certificate with their name attached to it, people who succeed. So that will be available in Pune. So we don't have to then go to a college. Assessment and training can be done at any one of the education institutes once the online training is done. So yes, for you in Pune, it will be available. Those 2 centers are there. Third center for pharma, or the first one of the pharma centers, will be at your college.
Okay, thank you, sir. Thank you.
Sir, one more question from audience is that what is a disaster preparedness?
What is disaster preparedness? Okay, yeah, very simple. Disaster preparedness, what does it seek to do? I don't know, Dr. Jagtap will have that slide with him. It seeks to prepare and reduce the adverse effects of disaster in simplest of the simplest way, okay? So if you're preparing it for it, what you're seeking is to actually reduce the impact, the adverse impact of disaster, okay? And if you're looking for preparedness, what does it involve? In preparedness, it involves is having your response team ready, okay? In your preparedness, your recovery team ready, your resources ready, and all of them, their aim is to reduce the impact, the healthcare impact of disaster. This is what disaster medicine. So if I give you an example of, say, Gujarat earthquake, okay? We were so badly prepared at Gujarat earthquake time that many of the people who had serious injuries, it took 3 to 4 days and sometimes 5 days before they were moved out of Kutch into Pune, into very southern region. And a lot of them actually had amputation, which were unnecessary, but it was too late at that time. So if they had actually been prepared for disaster and resources for surgical and other interventions were available close to that within 24 to 48 hours, then these amputations wouldn't have occurred. Okay. Sepsis, another problem. So if you're waiting for 4 or 5 days for reactive, and it's great to have disaster response force, but all they do is rescue. Where do people go? At a disaster, most of the people actually go via rickshaw, car, anything, ambulance to the nearest hospital they see. But the nearest hospital is not necessarily the best place for these people. They don't have the manpower and resources to manage that.
Okay. Okay, sir. Thank you, sir. Sir, one more question from audience is that how you differentiate all pharma sector in India and other country?
The pharma sector is slightly different. See, India has its own pharma sector. As you will know, China is one of the largest pharma sector. And then if you look at the Western world, US and Europe, these are actually not country-based pharma sectors. These are multinationals. And unfortunately, a huge amount of world's pharma sector is controlled by these multinationals, shareholders, and their aim is to make money. So the drugs we get here in UK, US, and Europe are 10 to 100 times more expensive than what we can get them in India. Okay, a lot of generic drugs made in India are bought in bulk by these multinationals under their own package name and then sold at 20 to 100 times more, over there. So I'm sorry, I would like to say or inform people that pharma industry is great. It saves lives and all that. But unfortunately, I think pharma industry is greedy. No matter where they go, their only intention is how can they make money.
Thank you, sir. Sir, another one question is that most of the healthcare professionals nowadays in COVID-19 deny to work in this situation. So, how to motivate them?
It's a good question. Okay, now the thing about the incentive and the rationale to work for healthcare professionals, one is to make sure that they understand that they can work safely. Okay, that they must have proper training, PPE. You just can't actually mandate doctors and nurses saying, by the way, we have a problem. Tomorrow you're going to come over and you're going to work in COVID centers. Because you know that thousands of people in healthcare professionals have actually lost their lives. Okay. A lot of them recover. The second thing is that if we in the healthcare professional do not support controlling and containing this disease, sooner or later we'll be affected, because those 50,000 will become 100,000. 100,000, we already have 1.2 million, 1.1 million cases in India. And we have to get together and be able to work with the government in partnership and take on the challenge. If it doesn't affect us, it will affect a member of our family, somebody in the community. And it's our responsibility as healthcare professionals, okay, it's just not the doctors, across the whole spectrum, to actually take on the COVID-19 challenge. Is the single largest challenge of the last 100 years.
Hello. Hello, good afternoon, sir. I have one question. What are the challenges approaching disaster apart from the physical challenges? You talked about the physical challenges, but I would like to know what are the another challenges that are having a problem to approach a disaster?
I mean, sorry, physical challenges to health or infrastructure?
Okay.
Sorry, which one?
Sir, both challenges.
Okay, so healthcare challenges, okay, is a mental health. That's a core challenge. So practically we ignore it. And a lot of people come in and try to actually help people with mental health challenges immediately after the disaster. There's enough research to actually show that people are in a shock state that no matter what you do, you're not taking on the support. The mental health problems actually come in 3 to 6 months later. So we actually really need to prepare people for, and the mental health is taken as a taboo. This is not mental health as in severe mental pathology. This is mostly psychological counseling, supporting, building the resilience. So that's one. In terms of other challenges, we have hospital preparedness. How many hospitals are really prepared for disasters? If you look at Chennai floods, the hospitals were completely incapacitated and they didn't have a clue what to do. But one hospital had its generator in the basement, it got flooded. Majority of his patient ICU died. And what the lead over there said to press, it's got nothing to do with disaster. these people are going to die anyway. That's very, very insensitive. So prepare a hospital for challenges. Right now, how many of our hospitals are really prepared for COVID-19? When I came in February, when I did a seminar, and we said, can I have a look at your PPE? And there was not a single hospital which I visited in those 4 major centers who had PPE fit for purpose. And how many of you, I don't know whether you've seen the masks, okay? So these are sort of non-clinical, but preparing for safety. Yeah, people say N95 mask or FFP2 mask or surgical mask. How many of the people in healthcare professional have been trained on how to put on that mask safely and use it safely?
Hello, good morning, sir.
Good morning.
I want to ask one question. First of all, I congratulate or thank you for giving a nice speech. My question is, so many people are discussing about the COVID-19, that is the corona. Whether it is a natural or artificial virus.
Okay.
Or second, as per your opinion. Or second question is, what is the remedy for the cure? And whether the lockdown is a one important remedy for the cure the corona. Or what is your the suggestion for the people to cure or to happy the peoples?
Okay, so let's start with the first question, okay? Corona, COVID-19, okay? And SARS and MERS, okay? These are the same family of the group of viruses, corona, okay? The MERS, SARS, okay? Now, when we started, we called it novel corona. And later on, we actually have the WHO has given its new name. It's called SARS-CoV-2. Okay? The original SARS is SARS-CoV-1. This is SARS-CoV-2. And it is a new variant of this group of virus. So it's a new virus. It's not man-made. Its sequencing has been done by so many independent laboratories. If you try to make it man-made, when you do the genetic sequencing, you can see those spices which you insert. To make it man-made, you have to have certain little bit of spices which actually, go in, and where it's been either modified or completely made. So it's not. So it's a new virus, a new variant. Now, a lot of people now, this comes to mutants. So we have had a few doctors on NDTV saying there are new mutants of this virus and they are more infective. I'm sorry, wrong. Mutation in virus can occur when only 1 or 2 amino acids change. Okay, so yes, we have several of those small minor mutations for SARS-CoV-2. Now, the difference between SARS-CoV-2 and COVID-19, technically SARS-CoV-2 is a virus and COVID-19 is the disease. But literature, everybody is calling COVID-19 as a virus as well. So now, coming to these small mutations, they do not change the macro changes of the virus is not changed. So whatever vaccine we produce will be actually useful even with those small mutations occurring. If any, the chances of very large mutation ever occurring, so far from what we know from MERS and SARS, and following those viruses, we haven't seen any in that group. Okay.
Thanks.
And on your second question is treatment or cure. Okay. There is no such thing as cure. It's a recovery. And it's going to be supportive, supportive work only. Now, supportive therapy, we have these most of these new drugs are actually on clinical trials. Okay. And on some of the clinical trials, they've shown some effect, but they also have adverse reactions. So we have a challenge. Out of all these 75 all vaccine candidates, 4 have completed clinical phase 1 and 2 trials. And now they're looking at the data, and hopefully we're going to start a clinical trial for phase 3. Okay. However, in my opinion, as I have worked on host defense mechanisms and vaccine production during my academic life, and look at all the vaccine production, you cannot fast track a vaccine production. Okay. There were a few doctors on the TV saying, oh yes, we can do the trials in parallel. I'm sorry, that's stupidity. You cannot do phase 2, 1, 2, and 3 in parallel, because the results of phase 1 tell you what you do in phase 2. And phase 2 tells you what you should do in phase 3. It cannot be done in parallel. Okay. And most of the vaccines, even the fastest one, which was produced recently, took 4 years. It can't be, it will not be done by 15th of August. I'm sorry, no matter what I say, it's just not possible. It takes time to evaluate the safety, and anything that comes up very, very fast in 5 to 6 months, the chances of it being unsafe are much higher and creating. So what we are here looking at is saying, you know, when you actually take medication, somebody already has a disease. So you're trying to improve, treat the disease. But when you're doing a vaccine, you're actually giving that vaccine to normal human beings and children who have no disease. And instead of actually stopping the disease, we might harm them more because it's given out in millions. So we really look at it in terms of containing it. Our only challenge is to contain. And the principle of containment is testing. Okay? Because if we do not know what's the prevalence of the disease in our community, we can't contain it. And by manipulating lower number of testing to say we don't have the disease in our community, such a small number, is ignoring the fact that there is a large number of people who keep on spreading it. And I don't know whether you saw the report 2-3 days ago. They did zero testing for COVID in Delhi. And just around 24% of the population, according to their report, actually had an IgG antibody. That means that 24% of the population actually are at that time possibly infected, because that antibodies can actually emerge within 6 to 11 days, or sometimes it takes 14 days to 30 days. Or they previously had a COVID-19 infection. But if that's what happened, then those 24%, how many contacts did they have and where did they spread it? So containment, testing, and good hygiene. And the hygiene is most important. Also, social distancing. There's not much point in opening up liquor shop and actually 500 people queuing up with no social distancing. There's not much point in actually having mass gatherings. All we're going to do is spread it.
Thank you, sir.
Thank you, sir.
Sir, with respect to our panelists and due to time constraint, we cannot take further new questions. I appeal all the audience to mail the queries to Dr. Patel, sir, and the same mail ID is given in chat box. So thank you, sir, for this interactive session and interactive or informative session. And now I request Mr. Sachin Kotwal, sir, to give a vote of thanks.
Thank you, sir. Before proceeding, I wish very warm, prosperous, healthy, happy birthday to our dynamic leader, Deputy Chief Minister of Maharashtra State and President of PD, Honorable Sri Ajit Pawar Sahib. It's my privilege to have been asked to propose vote of thanks on the occasion of this Ananta Mala and today's international webinar, Role of Pharma Profession in Disaster Medicine. On behalf of Pune District Education Association and entire supporting team, I extend my hearty vote of thanks to today's international speaker, Dr. Peter Patel, sir, for his valuable guidance on disaster medicine. He covered all the necessary information regarding, and also he covered all the disaster happened in India in past and its management. A big thanks to our Vice President Rajendra Gadge sir, and none other than our great vision, very dynamic personality. Honorable Secretary and Senate Member of Savitribai Phule Pune University, Advocate Sandeep Kadam Sahib. Really, his ideas come in truth. I am also thankful to Deputy Secretary L.M. Pawar sir, Treasurer Advocate Mohan Rao Deshmukh sir, Secretary A.M. Zadov, Assistant Secretary A.M. Zadov Sahib. I take this opportunity to thank Honorable Dr. Rajendra Jagtap sir, President, Society of Emergency Medical Services Maharashtra, Dr. Rajni Indulkar, Madam. Ladies and gentlemen, an event like this cannot be happen overnight. The wheels start rolling week ago. It requires planning and bird's eye for details. We have been fortunate enough to back with the dedicated team of our parent society, Principal of Kharadi Pharmacy College, Dr. Ashok Bosle sir, Principal of Saswad College, Rajeshri Chavan Madam, Principal Ashwini Shewale Madam, and all the supporting team, Dr. Manish Bhagat sir, Chevte sir, Amol Kale sir, Sagar Bishe sir, Kasbe sir. I also extend my vote of thanks to all the principals of PDA, other than PDA Institute, all the students who are participated here, all the HODs who attending this webinar. Once again, I'm most grateful to Dr. Pital Patel sir on this occasion. With the permission of our Honorable Secretary, I conclude this session. Thank you, sir. Thank you very much.
Thank you.
Thank you, sir.
Thank you,
Thank
sir.
you, sir.
Thank you, sir.
Thank you. Thank you.
Thank you. Have a great day, sir.
Thank you.
Thank you.
Thank you, sir. Thank you.
Thank you, sir. Thank you.
Thank you, sir.
Thank
Thank
you.
you.
Thank you, sir.
I must congratulate you on your visionary work, coming into Pune. And then I came to Sanskrit after many, many years and to see such great education initiatives coming from Pune. So fantastic. Thank you very much.
Thank you.
Thank you very much.
Sir, one
Madam,
thing.
congratulations.
Sir, I have one question.
Yes.
Hello.
Yes. Come on.
Hello. May I ask one question, sir?
Please do.
First of all, thank you very much, sir, for providing wonderful insights and very, very significant conversation on the topic, role of pharma profession in disaster medicine. So I am very much interested to know what role do actually pharmacists play in PHEC as far as disaster medicine is concerned. In pre-hospital emergency care, actually, what role do pharmacists play?
Okay.
Yes, sir.
Yeah. Well, pre-hospital emergency care at level 1 and 2, and what level 1 and 2 is, there's a lot of things you can do, from CPR to a range of skills which are appropriate, which a pharmacist can do. If you email me, I'll send you the details of what is involved in pre-hospital emergency care at level 1, and what is appropriate and suitable, because it's a long list to go through today, but more than happy to share with you the details.
Thank you, sir. Have a great day, sir. Thank you.
Thank you.
Thank you all.
Thank you.
Thank you, sir. Thank you.
क्लोज करायचंय का? हाँ मनीष.
Thank you.
हाँ सर. हाँ क्लोज करूया.
Yes.
Okay. Thank you, sir.
Thank you, sir.
Thank you.